Just okay. All right.
If I forget, yell.
I'll just wait.
Oh no.
So Wendy, I'm gonna take my mask off when I speak. So.
I will as well. I'm waiting so that we can do a little political theater.
Okay.
So that it's on camera. Hello, and welcome to all of you. Doylestown is glad to welcome you here today. I am State Representative Wendy Ullman of the 143rd Legislative District, and we are here to talk to you and share a few remarks about something that is of critical importance to all of us: affordable health care coverage for Pennsylvanians, especially now that we are in the grip of this unprecedented pandemic. Just last week, my office helped a woman from Bedminster sign up for health insurance through Pennsylvania's state-based exchange program. She was so grateful to learn that she would be covered for pre-existing conditions. You see, she had been diagnosed with breast cancer 3 years before. She was very worried that her cancer might reoccur, and because it was a pre-existing condition, insurance might not cover the costly treatments. We can promise her that if that time comes and she does need further treatment, her insurance will cover it, at least as long as we are able to defend the Affordable Care Act. The ACA has revolutionized American healthcare in so many ways. One of these is offering coverage to many people who previously had not been able to get insurance because they had pre-existing conditions. This pandemic has made these protections more important than ever before. Pennsylvanians cannot afford to lose the ACA during the economic uncertainties of the pandemic economy. They need this safety net. And COVID-19 has also taught us that many people with pre-existing conditions are among those who are most vulnerable to complications, hospitalization, and fatal outcomes if they become infected with the virus. They are our parents, our grandparents, our children, our friends, ourselves. Access to ACA coverage is helping to save lives. The future of the ACA is currently under threat. The Supreme Court is scheduled to hear arguments in the administration-supported litigation challenging a key part of the ACA. In the midst of this uncertainty over whether the Supreme Court will remove a key component of the ACA, we are also faced with the grim certainty: if the current Washington administration continues for 4 more years, the entire protective structure of the Affordable Care Act will be dismantled. We cannot let this happen in Pennsylvania. The Democratic caucus members of the General Assembly are united in our determination to protect access to affordable health care within our borders, regardless of the outcome of the federal election and regardless of the eventual makeup of the Supreme Court. We are striving to pass legislation that will serve as a firewall to preserve critical components of the Affordable Care Act for the citizens of our Commonwealth. In the State House, we are supporting 3 bills to guarantee aspects of the ACA in case federal protections disappear. These are coverage of pre-existing conditions, of essential health care components, and preventing lifetime caps on life-sustaining coverage. These protections must be given the force of law to ensure they remain in place for the many generations to come. And now, it is my distinct honor to introduce Governor Tom Wolf. From the beginning of his administration, Governor Wolf has been a champion of innovative and expansive health care. And since the onslaught of COVID-19, he has steered our Commonwealth through the vast complexities of this pandemic, protecting public health, formulating wise policy, and adapting to ever-changing variables. Ladies and gentlemen, Governor Tom Wolf.
Thank you, Representative Ullman. I was going to call you Wendy. Very nice to be here, and thank you for that nice introduction. And Senator and Anna, thank you for being here too. The point, and I just want to really follow up on what Representative Ullman said. We are living under the cloud here. There's a real specter that haunts and threatens us all, not just here in Pennsylvania, but all around the country. And that is, right now, the Supreme Court is on the verge of looking at an important element of the Affordable Care Act. But we really have, for the last 4 years, been under the threat that the Affordable Care Act would go away. And so what I want to do is just talk a little bit about what that means for us in Pennsylvania. It's a moral issue, and I think we're right to talk about that, the hundreds of thousands of people who would be negatively affected by that. But it's also a practical issue. And so I want to talk about both of those things. When I got to Harrisburg, I expanded Medicaid, which was part of the Affordable Care Act. And that put between 700,000 and 750,000 people under the insurance rules for the first time. Something I said? So anyway, the 720,000 people got health insurance who didn't have it before. We also ended up with people using the exchanges to get insurance who didn't have it before. This is really great. I really like it. So anyway, that took the uninsured rate in Pennsylvania to historic lows, less than 5%. And that had a huge impact, obviously, on the individuals and the families who now had health care and had access to health care who didn't have it before. But it did a lot of other things. It changed outcomes. The point is, we actually did have a national health insurance system before the Affordable Care Act. It was called the emergency room. It's the most expensive part of our health care system, and it's a part of our system that only attracts people who are in the most acute phases of a disease. And so we actually had worse outcomes in the United States than, most other developed countries in the world, because our healthcare system really wasn't able to do all the things a good healthcare system should do in providing access to healthcare to a lot of people. It was especially harmful to places where we really need to make sure we keep healthcare, poor, sparsely populated rural areas. Healthcare systems there were struggling because they had so much uncompensated care, and because they were in sparsely settled areas, didn't have a lot of people even seeking their help. But when they did, they weren't paying. With the expanded Medicaid, we actually had healthcare systems that were being paid. It was the salvation, in many ways, of financially struggling healthcare systems in our rural areas. Gene DiGirolamo is here, who, when he was in the State House, was a champion of addressing the opioid epidemic in Pennsylvania. Expanded Medicaid, actually gave coverage to people who were suffering from substance use disorder. For the first time, those folks could actually go get treatment for substance use disorder and have their providers, the people treating them, actually be reimbursed. The cost was another thing. I was in business until about 5 years and 8 months ago. Who's counting? But 5 years and 8 months ago, I was in business. And every year when we would sit down and talk about the cost of our insurance program, which kept going up and up and up, and again, the United States' healthcare costs back in the pre-Affordable Care Act days, way above other developed nations, and was rising at a much faster than inflation rate. But each year when we looked at what we were going to be doing with our insurance program, we wondered amongst ourselves, how much of what we're paying in premiums was going to cross-subsidize those people who were not paying? And you're still using the healthcare system, going to the emergency room and getting healthcare for free. All of those underinsured folks who had $10,000, $5,000 deductibles and who couldn't pay that, those underinsured folks were also causing financial hardship for our healthcare systems. How much of that cost was being shoved onto the private insured, people like us who were actually paying our insurance bills? It was a lot, and it varied depending on what the healthcare system was doing in terms of uncompensated care in the areas that we served. But we figured it was anywhere from 5 to 18, 20%. And that's a lot of money. So the cost was high. As Wendy said, in the era of the COVID pandemic, I think we have a better understanding than ever what it means to have access to health care. And as all of you know, there are this term called long haulers, people who have suffered from the virus and who have seemingly recovered. Many of them actually have long-term health effects, affects their heart, their other organs. And for that, they're going to be needing health care for the rest of their lives. What happens if they depend on affordable health care, affordable insurance, and that's denied to them? Those long haulers are going to be really, really in trouble. So the point is that we all have to do what we can to make sure Washington does the right thing. We are doing the right thing. And I want to point out that right now the Democratic Party is in the minority in both the Senate and the House. I'm a Democrat, but that's the backstop. And it would be really nice to be able to say to ordinary Pennsylvanians, we're going to have your back when it comes to health care. But what we really need is for Washington right now, that's the focus of activity. We need Washington to do the right thing. First, in terms of the decision they have to make, whether they're going to confirm or not a Supreme Court justice, and whether that Supreme Court justice is going to be someone who is going to support the Affordable Care Act or not. I think this is an existential decision that our folks in Washington are making, and we need to make sure that they make the right decision. I've called on Senator Toomey. I know Senator Casey is going to do the right thing, but I'm calling on Senator Toomey to do the right thing. Actually, I'm calling on Senator Toomey to do what he said he was going to do and what he did back when President Obama made a Supreme Court nomination. Just follow through on the things that you said back then. Let the people of the United States decide in this election, which is not months away as it was back then, but weeks away. And let the people of the United States decide what we want, and then follow through on that after the election. I think that's what we need to have happen, because we cannot afford, as Pennsylvanians, as Americans, to move away from affordable health care. Should the ACA be improved? Absolutely. I don't think there's anybody who doesn't think we could do a better job and move forward. But what we can't do is go back to what we had before, which was basically the emergency room. So I urge everybody here in Doylestown, in Bucks County, in Pennsylvania, in the United States, and all of us working together to make sure we do everything we can to assure that the Affordable Care Act, if anything, gets stronger, that we don't dismantle it and go back to the way we were. And now it's my great pleasure to introduce another great ally of mine in Harrisburg, and thank you very much, Bucks County, for sending him to Harrisburg, and Wendy as well. But let me turn it over to Senator Steve Santarsiero. Steve.
Good morning. And thank you, Governor Wolf, for your really amazing leadership over these last 8 months during this pandemic, and that of Secretary Levine. None of us should make any mistake. Your leadership has saved lives, and we have been happy to stand with you in furthering that goal and keeping our communities safe. We're here today to talk about health care, but in a broader sense, we're really here to talk about our system of government. Because as the governor just said, a remade United States Supreme Court has within its power the ability to put these issues back on the states assuming, of course, that the states are willing to act. Yes, we're talking about health care, but make no mistake. This also includes upholding the right of people to marry who they love. It includes the right of women to reproductive freedom. It includes our voting rights and so many other issues that we, in this era now, take for granted because of the actions of a Supreme Court. And if the Supreme Court reverses itself on these issues, including the Affordable Care Act, they are coming to state legislatures near you. So understand what is in front of us and what the stakes are. Now, as my colleague in the State House, Representative Ullman, was talking about before, we have legislation in both chambers that seek to ensure the protections of the Affordable Care Act should the worst case scenario happen and should the United States Supreme Court decide that all or parts of the act are unconstitutional. Senate Bill 50 and Senate Bill 51 are my legislation. They go to the pre-existing condition issue, as well as protecting essential procedures and health benefits, similar to what the House legislation has. We also have the cap on insurance, and most importantly, from a perspective of a dad who has some 20-somethings in his household, making sure that our children can stay on our health care policies until the age of 26. Now, 10 years ago when the ACA was passed, there was a lot of misinformation that was put out about death panels and a whole bunch of other things, all in an effort to derail expanding coverage across the United States. But what we have seen in those ensuing 10 years is that expansion is allowing people to be able to get health care at a reasonable cost. A big part of that happened here in Pennsylvania when Governor Wolf took office and reversed the position of his predecessor by making sure that we would expand Medicaid under the ACA here in Pennsylvania. That immediately insured about 750,000 Pennsylvanians. And that doesn't count all the other Pennsylvanians who have gotten health care insurance through the exchanges under the ACA. Do we want to go backward? Do we really want to go back and throw all those folks off of health care and put them back into the emergency room as their primary care physician? It is not only inherently unfair, and I would argue a violation of their fundamental rights for health care, but it's just dumb from a policy standpoint because the cost that it then puts on the system is hard to bear. So we don't know what will happen. We hope that Senator Toomey will not be hypocritical and will follow what he and his fellow Republicans did 4 years ago when they prevented Judge Garland from having even a hearing, let alone a vote. But if that doesn't happen, and a new justice is put on the Supreme Court who is potentially antagonistic to the ACA, we had better be ready here in Pennsylvania to make sure that we provide these protections. We had better be ready to make sure we have members in the State Senate and the State House who will work as partners with Governor Wolf to make sure that happens, to make sure that Pennsylvanians do not get thrown off their health care, to make sure that people can have healthy lives, a fundamental right that every Pennsylvanian should be able to enjoy. We have a lot on our plates, and we have a lot of decisions that face all of us, not just elected officials and legislators and governors, but ordinary citizens. Whether we're going to make the choices that are going to help us move forward, not do away with the ACA, but expand it to include the public option that arguably should have been in it in the first place. Those are the decisions that are in front of us. We are at a critical point now on this and all those other issues. And so I again thank the governor for his leadership. I thank my colleague, Representative Ullman, for her leadership on these issues in the State House. And I want to introduce now someone who I've known for a long time and who is going to speak from personal experience and from the heart about the importance of the protections of the Affordable Care Act and what it means to real people. She is a rising star here in Bucks County. She is recently elected to the Middletown Board of Supervisors, but she has served for some time now as the executive assistant to the chair of the county commissioners, Diane Marseglia, who just joined us. Diane. And she has been a tireless advocate for people with pre-existing conditions to make sure they have the health coverage they need to have healthy lives and to live. So with that, I'm happy to introduce my friend, Anna Payne. Anna?
Oh, thank you. Oh, okay. There we go. As you heard, my name's Anna Payne, and I live with cystic fibrosis, which is a rare genetic disease that has no cure, and it impacts primarily your respiratory and digestive systems. My life has revolved around health insurance coverage. It is life or death for people like me. My prescriptions alone cost $50,000 a month. A month. And that's just to maintain my health. That does not include doctor's visits, hospital stays, or any other tests or procedures that I may need. Prior to the ACA, I was kicked off my mother's insurance because I capped out. I was too expensive. I literally can't breathe or eat without medication. My life stopped. You can't function without being able to eat and breathe. It was a scary time, not knowing where or how I would get insurance coverage to survive. I was without coverage for about 3 months. In those 3 months, I had to ration medication. I had to make it last until I could hopefully qualify for Medicaid. Since the ACA passed, my life has become less stressful. I no longer worry that I can cap out or lose coverage. I've thrived. I'm healthier and I'm outliving my life expectancy. This legislation gave people like me the flexibility to go back to school or change careers without concern that we wouldn't be able to obtain coverage. This was huge. Not only would we not have to worry about being dropped, we could go to the marketplace and get insurance. I have lost countless nights of sleep when the repeal conversation started in 2017. And this pending lawsuit is having the same effect. While in the midst of a pandemic, the idea that coverage could be taken away from so many people makes me sick. If the Supreme Court strikes down the law, will we go back to a time where insurance companies just viewed me as a liability on their spreadsheet? I won't be seen as a person living a full and productive life. We would have no way of assuring that the insurance company wouldn't drop me and I would not reach my lifetime cap again. Will I have to ration medication? And if I do, how sick will I get? I wouldn't be able to go to the marketplace if for some reason I ended up out of work or changed jobs because I would be disqualified because of my condition. If they didn't want to cover me before the ACA, why would they now? This is what keeps me up at night. This is what I feel people do not understand about the severity of this pending situation. And I want to thank the governor, Representative Santarsiero, and Representative Ullman for coming today and realizing how detrimental the elimination of the ACA would be for me and so many Pennsylvanians. Thank you. Governor Wolf.
Thank you very much, Anna. I mean, I think that's a very eloquent defense of the Affordable Care Act. There's very practical and personal reasons to want to keep that in place. Okay, any of us would be happy to take questions now. Any questions? Yes.
Not related to health care, but given the election is coming up, I did want to ask, is there, about a year ago, there was a story from the Associated Press, several companies that make voting machines were still using Windows XP. Over the last few days, the source code for Windows XP leaked online. There have been concerns of security threats to a lot of different applications. I was wondering if the Department of State was looking into that.
Yeah, I don't know for a fact, so I will have someone get back to you on that. We as you know, this last year, the General Assembly and the Commonwealth made $90 million available to all 67 counties to make sure that we had voting machines with paper trails that actually were designed to make sure that we did the best we possibly could to make voting safe. So I don't know about this specific issue, but I will find out. And Sarah, will you make sure you get an answer there? Okay. Any other questions? Yeah.
With regard to voting, staying on that topic, obviously a lot of controversy around mail-in ballots. Would you like to speak to the security and legitimacy of mail-in ballots in Pennsylvania?
Yeah, first of all, that's the way I'm voting. Apparently that's the way the president is voting, along with his wife, too. So I'm not sure where this has come from. We have been voting by mail absentee ballots since, I think, the Civil War in Pennsylvania. So it's been, 160 years we've been voting by mail, and this has not been a problem before. The June primary, we got the, what you're talking about is the expansion of the vote by mail. The absentee ballots, now you can get them without needing an excuse. You had to have an excuse before. That was the change. The other change is what I just pointed out, that the Commonwealth has invested $90 million in new machines, so that if you still want to vote the way you voted before, you can do that. The only difference is you're voting now on newer machines with a paper trail. Oh, and the other thing is that you have, you can register 2 weeks closer to the election time than you could before. Other than that, everything's exactly the same. All we've done with changing voting is adding options. If you want to vote by mail, you can do that, and that means you can vote. You apply online, and you get your ballot in the mail, or you can actually go to the election office, pick up your ballot, and you can take it home and vote in the privacy of your own home. In Pennsylvania, absent any challenges, we have 50 days to vote now, not just 1 day. So if you have a job that keeps you from coming to vote on election day, that's not a hurdle anymore. You have 50 days. Now, with the challenge here, I think it's down to 40 days to vote, but it's still more than the 1 day that we used to have. Again, you can drop it in the mail. If your area has drop boxes, you can drop it in a drop box, or you can take it back to the voting office and give them your ballot, or you can take it to the polls on election day. So I'm not sure where the concern has come from. We've been doing this for well over a century, and what the Act 77 did, which was a bipartisan act, actually had more Republican votes than Democratic votes, but it expanded access to the polls. It took everything we were doing before and just added options. So you can do exactly what you did before, and if you want to do that, or you can do things differently if you want to do that. I think everything is in really good shape. And I think what we saw in the June 2nd primary is that people got their votes counted, and more people voted in that primary than any other presidential primary. You have to go back to, I think, 2012, when you had sort of an apples-to-apples comparison. You had 2 presidential primaries that were really not being contested by the time it got to Pennsylvania. And if you compare 2012 with 2020, we actually had more people vote in the 2020 presidential primary.
Thank you.
Anything else? Okay, thank you, everybody, and thank you again for being here. Representative Ullman, Anna,